the reception has paused. Let's see, are we live here on Instagram? I know we are live here on Facebook. Facebook, give me a moment. I want to say hi to Instagram and get hooked up. Okay, we are here live on Facebook. How's that sound, everyone? Is that sounding good? Hi, I think that says Stassi082. Nice to see you. I want to wave and say hi. Thank you for joining us. Oops, sorry, Facebook. We're working this out. We're going to figure it out. Hi, everyone. We're going to give some people a few more moments to get in. We are here casting live from South Florida, and it is wet over here. It is wet. You guys say prayers for us because we already feel like we're seeing some really good thunderstorms and hurricane season type weather, which we do not like here in South Florida, but we have to get ready for that. I'm gonna wave here and just say hi. I want to say hello to all my Tuesday Transformers. Thank you for joining us, Tuesday Transformers. And that is you, if you are Tuesday Transformers. If you were on Instagram, you saw my Tuesday Transformers are those individuals who join us every Tuesday who are serious about transforming their lives. Hi, Nixie. I'm going to say hi to you for joining. When you come on into the chat, go ahead and say hi. So just in way of housekeeping, when I'm looking here, it's because I'm looking at my Facebook folks. Hi, Facebook. Not to ignore when I'm looking here because I'm looking at my Instagram, folks. Hey, Instagram, good seeing you guys again. And I'm going to do my best to make sure I'm looking both places so that we could definitely interact and get everyone else on board. Hi, Tani's22. Thank you for joining us. And we're going to give a little bit more time for Facebook. We're doing something different on Facebook today. So we'll see if it's either going to really work well or it's really not going to work at all. And then we just figure out where to go. All right, so as we're getting in here, I want you guys to get settled, get those kids to bed. For a lot of people, tomorrow's the first day of school, so hopefully your kids are in bed like mine, and hopefully you don't come through that door. But if they do, like you know, we're just gonna roll with the punches. So as you know, this is Dr. Sabine Elisee, board certified family medicine physician, CEO and co-founder of Cornerstone Medical Group Incorporated. I provide simple, concrete understanding to what's going on in your body so that you can do two things. One, identify how it's affecting your overall well-being, and two, identify how it's affecting your daily productivity. And we all wanna be productive in our lives. How do I do that? I do that through my medical expertise, and I do that through my restorative approach to patient care that focuses on the entire body, reconnecting the physical, spiritual, and mental components of your health so that you could maximize and increase the quality of life, all right? So once again, hello, thank you for joining, and we're gonna go right into our discussion today. Today we are speaking about heartburn. So go ahead and put heartburn inside the comment box there, heartburn. We're gonna speak about 3 things that you can do to help control those symptoms. That's first of all. And then we're also gonna identify exactly what is heartburn. You know, this is something that I started doing more with my patients, actually truly from my 8-year-old son. So when I would tell him to stop doing something, of course, he wouldn't stop. But when I would explain to him the why I need him to stop doing something, I noticed it was then that he actually started following through with what I'm instructing him to do. And I think the same is true also for us as adults, right? If we understand the why something's going on, then we could better understand what to do to prevent it and how it's going to help us. And then that way too, you could be making more informed decisions about your health. And that's what all this is about, right? You're my Tuesday Transformers. You're here because you are intentional about transforming your health. You're here because you want to be very intentional and take an active role in taking care of your health. And once you understand the baseline of what's going on in a certain illness or a process or a symptom that you're feeling, that'll help you better understanding. So once again, we're talking about heartburn today. We're gonna go right into it. What is heartburn? So heartburn is something that people will call reflux, acid reflux sometimes. Some people will call it indigestion. And then many times we'll actually call it or label it as GERD. I wanna let you know that some of the literature is telling us that people will wait 1 to 3 years, all right? I'm gonna put that in the comment box here in my Facebook, people. It's too much for me to put it there, so someone go ahead and add that in the comment box. 1 to 3 years. People will wait 1 to 3 years before speaking to their doctor about the heartburn that they're having. And that is something I never want you to do. I never want you to wait that long in speaking about heartburn. And here's the thing, because some people will say, oh, it's just a little heartburn. I took a few Tums. I feel a little better. It went away. But we cannot just immediately assume that something is just a simple heartburn. I'm going to give you a secret as a physician. As a physician, anytime someone comes to me and says that they're having pain from their throat to their epigastric region, so anytime they're having pain anywhere between those regions, I want to make sure it's not their heart. And I say especially this for my women, because a lot of times women will go into the emergency room, or they'll just say that they're having heartburn, they're having indigestion. They'll be dismissed as being emotional, or they'll be dismissed as being, just too dramatic with what's going on. And many times that's a cardiac event that's going on. So I want you to make me the promise, my Tuesday Transformers, that if in fact you are having heartburn, you're not going to just dismiss it. You're not going to wait 1 to 3 years before actually discussing it with your doctor. I want you to actually go ahead and discuss that with your doctor, because we want to make sure that your heartburn is not cardiac related, okay? And it's very simple. So when a patient comes in, they're telling me they're having heartburn, and they're telling me about that a little bit too much, and I'm asking key questions and specific questions about what they're feeling, then I'll know whether or not right then and there in that appointment, whether or not I need to get an EKG on them, and then probably subsequently follow up with a stress test depending on what their symptoms are. So number one promise, say I promise. I want you to put in I promise in that comment line. If you are having heartburn, or if someone else you know is just discussing having some heartburn a little bit too much, I want you to promise and put in I promise that you are not going to wait 1 to 3 years before discussing it with your physicians, as our numbers are indicating in the literature. So number one, I want you to tell your physician as soon as that you're having that heartburn, so that we can make sure it is not cardiac related. That's number one. Number two, I want you to also, as you're discussing it with your physician, and here's the second reason why this is important, not to just dismiss or ignore those symptoms, because sometimes those symptoms can actually really be secondary to bacterial infection. And we know that we have antibiotics to treat bacteria. So if there's a bacteria infection, then we treat it with antibiotics. So it's a simple test that we can do in the office, to make sure it's not a bacteria infection. That bacteria is called H. pylori. That bacteria, again, is called H. pylori. And it's a breath test. That's what it's called. We do this test, and if it's H. pylori, we treat it. About 2 weeks of antibiotics, a couple of different antibiotics that you take, and then done. We want to make sure we kill that bacteria, because if we do not kill that bacteria, when it hangs out in your stomach for too long, if it hangs out and does what it's known to do, destruction, right, then that could actually lead to some forms of cancer. So it's very important that we are not dismissing heartburn. So my Tuesday Transformers are not going to be dismissing heartburn. And if someone they know, their loved one, is speaking about heartburn too, I know that my Tuesday Transformers, because of this talk, will not be dismissing heartburn, and they will be encouraging their friends and family members to make sure they go get that checked. So that's really the first two things I want to talk to you about. The most important thing of making sure you follow up that heartburn and don't dismiss it. So let's talk about exactly what goes on if it's truly just acid reflux, okay? So our stomach has acid in it. That acid is there to just break down all the good foods that we eat, to make sure that we could go into the digestion portion of it. But right at the lower portion of our esophagus, so where the food comes down, there's what's called a sphincter that should be tight like this, right? I'm trying to twist my hand here so you guys can see. So it should be nice and closed, tight like this, a sphincter, right? It should be tight and closed, tight like this. But a lot of people who have symptoms of heartburn or reflux, that sphincter tends to open up. So what do you know happens naturally? The acid from the stomach ends up going into the esophagus, and that's what's actually producing those feelings and that symptoms that you feel of the heartburn, all right? So what causes what we call that lower esophageal sphincter, that tight thing. This is so weird trying to twist this here. So that tightness that should be closed off. What causes that to loosen up like that? Caffeine. Caffeine can cause that to loosen up. Women who are pregnant, and as they begin to grow and go further along in their gestational weeks, that will loosen up that sphincter a little bit. And then that will also let you know that if you're gaining weight in your abdomen area, that's also going to loosen up that sphincter. And when that sphincter is opened up like that, the acid in our stomach goes up into our esophagus, and that's why we feel that heartburn. So that's the why of what's going on with heartburn, and that's how we feel it. Give me a thumbs up if that made sense to you. Just go ahead and put a thumbs up, or I got you, Dr. Elisee, because I want to make sure you're understanding what I'm talking to you about my Tuesday Transformers. So that's what heartburn comes from. That's what reflux comes from. And we spoke about how we want to make sure that reflux is not a cardiac issue, and we want to also make sure reflux is not a bacterial issue that we make sure we treat. So what do we do now to treat or to control the symptoms of heartburn? Well, it's quite simple. We're going to talk about 3 things that we do. Number 1, the first thing that you want to make sure that you're doing is you want to avoid acidic foods. Avoid acidic foods. So what are our acidic foods? Some of our acidic foods are limes, are lemons, anything that has a tomato base. These things are acidic foods, and they will irritate that acid reflux more. So it'll make you have more symptoms. If you, like us, if you tend to kind of clean your meat with sour oranges, or you're using a lot of lime and vinegar to clean your meat, that is acidic. If you're not rinsing that off well before you cook it, then that could also act upon your heartburn a little bit more and make the symptoms worse. So number 1, avoid acidic foods. So no acid foods. And we said, what are some of those acid foods or acidic foods? I'm putting it here in the chat for you. No acidic foods. What are some of those acidic foods? We said lemon, we said lime, we said orange juice. I didn't say orange juice, lemon juice, lime juice. Avoid those acidic foods. All of those things will kind of irritate that acid reflux more. And even tomato-based foods, so even our pasta. And everyone's a little bit different. Everyone's a little different in their sensitivity. So you'll pay attention to which one is aggravating you a little bit more if you're having any of those symptoms. So number 1, avoid those acidic foods. Number 2, the other thing that you want to do, you want to avoid spicy foods. I know, I love my pickles too, guys. But if you have acid reflux, those pickles, those Scotch bonnet peppers, all of that, it's gonna irritate it more. So you want to pull back on that, right? You want to pull back on that. So no spicy. So go ahead and put in the comment line, no spicy. Instagram, if someone could put that in there for me, because I can't reach over like this to try to figure that out, right? So you want to no spicy foods. Get away from those pickles, get away from the Scotch bonnet peppers, pull back on those, because that's just gonna irritate the acid reflux more. And then our number 3 thing that you wanna do too, there's so many things that we can talk about, but here are the top 3 things we're gonna talk about. The third thing that you wanna do too, so this goes back to what we were mentioning about just the nature of what acid reflux is that sphincter that's very tight, should be tight, that loosens up. What you want to do is you want to understand that you want gravity to work for you and not against you. So after you eat a big meal, after eating a big meal, if you are eating, if you are suffering from reflux or acid reflux or heartburn, after eating a big meal, you want to sit up straight for at least 30 minutes. When you lay down, when you're laying down or going to bed immediately after you eat, that loosens up that sphincter a little bit more. Gravity is not working in your favor to keep that closed. And that's also gonna, cause that acid to go up and give more of those symptoms that we're speaking about in terms of having the acid reflux. So those are the big 3 things that you want to make sure you're doing. Avoid acidic foods, avoid spicy foods, and after you eat, sit up. I want you to sit up for at least 30 minutes after eating and not lay down, because that's also going to cause that acid to go up. Since we are here and we still have a little bit more time, I want to add one more bonus to that, which you want to do too. A lot of people have a tendency to eat all of their food and then take sips of water. If that's you, go ahead and wave at me there. A lot of people have a tendency to eat all of their food and then take sips of water. And that's something I want you to stop doing, because that water that you're drinking after 2 or 3 bites of the food is help pushing things down. It's help getting things down to where they need to be, so that way your body can do its job and digesting the food that it needs to eat. So that bonus thing I want to tell you who are suffering from acid reflux, after eating 2-3 bites, drink some water. 2-3 bites, get some fluids in. 2-3 bites, drink. Don't eat everything on your plate and then drink your water, but do it in between to make sure that that food is going down and being well digested. All right, so that's it for our talk today. I do want to get a chance to say hi and answer some questions as well too. I want to say hi to Janine, Senior Barbie. Thanks for joining us. Look at my Tuesday Transformers. Denise, Joseph. Hi, Nadesh. How are you? So glad you could join on. For Landy, good seeing you. Yes, no spicy foods. No spicy foods. No more pickles. I see people saying that here. I'm gonna try to see here. Oh, let me do it this way to see what's going on with my Instagram. We said hi to C Nixie. We said hi to C Tani's, and then we're also gonna say hi to Nosmatic who joins. We see Heartburn, Heartburn, Heartburn. Yes. 1 to 3 years. That's like we said, people will wait 1 to 3 years before speaking to their doctor about heartburn, and you don't want to do that because we want to make sure that it's not a cardiac issue. We want to make sure it's not a bacteria that can be simply fixed by taking antibiotics, because if that bacteria hangs out in your body for too long, remember that bacteria can lead to cancer. It can lead to cancer. I want to say hi to the San Marshall. Good seeing you. I want to wave here. Good seeing you. Thanks for joining us. I want to also say hi to Dr. Reese Ake. Dr. Reese Aker too. Hi, Dr. Reese Aker too. Thanks for joining us. Okay, and then there's some questions here. Someone said, do not wait to discuss heartburn with your physician. Absolutely. And I see someone did make the promise that they will not wait 1 to 2 years. Thanks, C Nixie, for making that promise. I see you, Tuesday Transformers. Stassi, I'm trying to read backwards here. Stassi082 also said the same thing. She will not wait 2 years. I want to say hi to Elise, Remy, Boyce, ENT. Good seeing you. Thank you for joining us. Let's see, who else do we have here as well. And BellNurse.Anna, good seeing you. Do we have any questions? Hi. I want to say hi to Omar, San, good seeing you. I want to wave here. Anyone else who has any questions before we sign out here? Remember, I always try to do this very quickly. I want to say hi to Evelyn Unbreakable. Good joining. I'm glad you could join us. I want to say hello to all my Tuesday Transformers again. I am Dr. Sabine Elisee, board-certified family medicine physician, CEO and co-founder of Cornerstone Medical Group. I provide simple, concrete understanding to what's going on in your body so that you can identify 2 things: what's going on in your body so that you'll know how it's affecting your overall well-being and how it's affecting your daily productivity. Since we don't have any questions, we're gonna go ahead and sign out. Remember, if there's something that you want to talk about, or you wanna hear more about, on our Tuesday Transformer Let's Talk Tuesdays, then go ahead and shoot me a message either through Instagram or through Facebook. We'd love to discuss that. And of course, if you find that this information was beneficial to you, go ahead and share it with someone else, because you never know how that could help someone else as well too. All right. Good seeing all of you. You guys who are here in South Florida, stay dry. Probably go ahead and pack up on that water as hurricane season seems to be approaching. Say a prayer for us so that it doesn't hit us too hard. And I want to say hi to 03 Ron, who just joins us. Hit the playback because we're about to sign out here, man. It's going on 9 o'clock. We got to go to sleep. Good seeing you guys. Take care. Bye. Thanks for joining us. Bye.